Cystic fibrosis is the most common fatal genetic disease affecting Canadian children and young adults. Pulmonary disease remains the most frequent cause of morbidity and mortality in patients with CF. Non-invasive positive pressure ventilation, or NPPV, has been shown to improve outcomes in end-stage CF lung disease and has been used as an adjunct to chest physiotherapy to improve airway clearance. It is increasingly being recognized as a possible bridge to transplant, given that it has been shown to slow the decline in lung function and positively impact BMI. Our research characterizes the use of NPPV in CF using patient data from the Canadian CF Registry. The National Canadian CF Registry was created in the early 1970s with the goal of monitoring important clinical trends in the CF population. This registry contains data from 42 accredited cystic fibrosis clinics. We identified patients with severe CF-related lung disease and divided them based on the use of NPPV between the years of 2011 and 2018. We defined patients as having severe CF-related lung disease if they had at least one PCO2 value of greater than 45 and one FEV1% predicted of less than 40. A number of patient parameters were then compared between the two groups. In total, 219 patients were identified. 72 of these patients used NPPV during our study period. FEV1% predicted was found to be 7.3% lower in the NPPV group. The NPPV group also had higher rates of feeding tube insertions and were more likely to require home oxygen and lung transplants. The prevalence of Stenotrophomonas and Aspergillus were higher in this group, while rates of Pseudomonas aeruginosa were higher in the non-NPPV group. When comparing the two groups, no difference was observed in the rates of CF-related diabetes, pancreatic status, or BMI. The number of home IV antibiotic days and the number of times patients were admitted to hospital for a pulmonary indication also did not differ between the two groups. In summary, over 30% of Canadian CF patients with end-stage lung disease received NPPV during our study period. In our patient population, this intervention was associated with lower lung function, the need for nutritional supplementation, and lung transplant. Further prospective investigation is needed to understand the effects of chronic NPPV use in CF and to identify a subset of patients that are most likely to benefit from this intervention. Thank you.